Thanks for inviting me. My name is Dr. Maria Cahuana. It's a great pleasure and honor to be here. Today I'll be talking about the article presentation. The title is Gender and Outcomes in Non-Small Cell Lung Cancer, and no prognostic variable comes back for target therapy and immunotherapy. Introduction. Lung cancer is responsible for 1.6 million deaths each year, with smoking being the main risk factor. Also, lung cancer has historically primarily affected men. The difference in lung cancer incidence between genders has narrowed in recent years. Differences in susceptibility to lung cancer are also observed after exposure to tobacco smoke, higher in women. The difference in clinical outcome between male and female patients with non-small cell lung cancer (NSCLC) is well known and has been addressed in several reports in which women have a lower risk of progression and death even when adjusted for age, histology, and stage. Because cancer is a heterogeneous entity, difference in treatment response and outcomes could also be related to a different distribution in clinical pathological features, for example, smoking, histology, EGFR mutations, and others. In previous work, we analyzed gender-associated difference in the enrichment of autoimmune gene seeds in NSCLC, where, regardless of smoking status or histological, women had higher expression of gene sets associated with immune process. Some therapeutic strategies involve manipulation of the immune system, while the immune system per se helps shape the evolution of cancer, determining the difference in tumor aggressiveness in response to treatment. In this work, several randomized clinical trials were evaluated to explore the influence of gender on the outcome of patients with NSCLC treated with targeted therapy and immunotherapy. Methods: Meta-analysis. The meta-analysis was performed with Redman v.5 software. Gender outcome compared in usual setting for overall survival (OS) and progression-free survival (PFS) in randomized phase 3 clinical trials. Meta-analysis of gender differences in OS. Information was retrieved from 67 published records, of which 12 were eligible for data extraction. Gender-specific benefit of targeted therapy and immunotherapy in terms of PFS. Meta-analysis of EGFR tyrosine kinase inhibitors. In total, 6 clinical trials were identified that evaluate EGFR TKI versus chemotherapy in patients with NSCLC with EGFR mutations in which gefitinib, erlotinib, or afatinib were evaluated. Meta-analysis of ALK inhibitors. The study evaluated 4 randomized trials comparing ALK inhibitors versus chemotherapy in patients with NSCLC whose tumor had ALK rearrangements. Evaluated 2 studies with ceritinib and 2 studies crizotinib. Meta-analysis of anti-PD-1 inhibitors. We evaluate 5 randomized studies comparing anti-PD-1 inhibitors versus chemotherapy including two studies with pembrolizumab versus chemotherapy and two with nivolumab versus chemotherapy. Results: improved OS in female patients in routine setting data. In total, 7 studies were identified for multivariate analysis of OS. The results indicate that females have a lower risk of death compared to males, HR 0.73. Effect of gender on the benefit of targeted therapy and immunotherapy in terms of PFS. Anti-EGFR TKI. In total, 931 female and 494 male patients were evaluated. Meta-analysis in male patients showed an HR 0.44 in favor of EGFR inhibitors. Anti-ALK inhibitors, 751 female and 536 male patients were evaluated. The benefit of ALK inhibitors was similar for both sexes. HR 0.48 for men and HR 0.51 for women. Anti-PD-1 inhibitors: 1,028 female and 1,435 male patients were evaluated. Anti-PD-1 inhibitors significantly improve PFS in male patients compared with chemotherapy. HR 0.76. In contrast, women show no benefit. Discussion: clear differences in gender outcomes were shown between some targeted therapies. It is well known fact that women have better outcomes than men in various types of cancer. In our data of the article, the meta-analysis with random effects shows a 27% reduction in the risk of death in female patients. EGFR alterations are more common in female patients. There is a great need to include the sex variable in the results of clinical trials, mainly in immunotherapy. Conclusion: the results of the exploratory analysis suggest the need to reevaluate the influence of gender on the treatment effect in a retrospective and prospective controlled manner in subsequent clinical trials of immunotherapy and targeted therapy. Clinical practice points: in this exploratory study, some targeted treatments were influenced by gender. Despite the difference in results that could be attributed to different histological characteristics, EGFR and smoking, gender should be analyzed in depth in current trials as a prognostic variable in patients with cancer, NSCLC. Thanks for your attention.